The CDC reports nearly 25% of all U.S. Americans suffer from chronic pain. It usually lasts longer than 3 months and could impact a person's ability to function. Finding the root cause of chronic pain can also be a long journey. National Health reporter Aaron Billups joining us now to discuss how chronic pelvic pain is often misdiagnosed, or sometimes it's missed altogether.
Yeah, so Augustine, about a quarter of women and up to 16% of men experience chronic pelvic pain, and until recently, it often goes undiagnosed, sending many on a quest involving unnecessary tests, sometimes leading to other health issues. Turns out up to 40% of patients with CPP have a condition called pelvic venous disorder. It's basically varicose veins in your pelvic area. Common symptoms are feelings of pelvic heaviness that gets worse as the day wears on. The pain is also pronounced when you're standing a lot or doing activities like riding a bike. Prolonged postcoital pain is also a common symptom. It can be diagnosed through an ultrasound followed by other imaging like an MRI or a CT scan. I spoke with diagnostic radiologist John Hogg. He says oftentimes pelvic venous disorder is caused by something pressing down on the vein like a fibroid.
It's much like if you had a garden hose or say the fire hose and you step on it, well, the pressure backs up, not as much returning. So it's that back pressure that then dilates those other veins out in the pelvis, or they may be in the upper thighs or in the reproductive areas.
So that backed up pressure not only causes pain, but it could lead to issues in other systems like gastrointestinal problems, back pain, sometimes irreversible chronic conditions like lymphedema. That's a kind of swelling that happens in the legs, Augustine.
Aaron, why is it that pelvic venous disorder is so often missed as a pain diagnosis?
You know, there really wasn't a formal classification to diagnose the disorder until about 2021, when a panel of experts convened by the American Vein and Lymphatic Society developed a clearer way to diagnose pelvic venous disorder. And, you know, many primary care providers and specialists may not be familiar with the condition. It simply is something that they don't know to look for or forget to look for because it's not well known just yet, Augustine.
Well, considering all that, Aaron, is this something that's easy to treat?
So Dr. Hogg says it can be treated fairly easily, which can be life-changing because the goal is to get rid of the pain, right? So they can do minimally invasive procedures like angioplasty or embolization. Sometimes whatever is pressing down on the vein needs to be removed, like a fibroid or, in rare cases, a tumor. Augustine?
All right, very important information to know. Aaron, as always, thank you for your report.